Thanks for joining the GW Online Healthcare MBA Info Session. We are excited to have with us panelists from both the GW School of Business as well as the GW School of Medicine and Health Sciences, who are here to present valuable insights about GW's Online Healthcare MBA's unique curriculum, and they'll also be available during Q&A to take your questions. I'm Kira, your moderator for today. Before I introduce you to our panelists, let's go over some housekeeping items. As your lines are currently muted, please feel free to forward any questions you have by activating the Q&A window at the bottom menu. It's the purple icon on your menu bar. Other functions to note on your menu are the resources icon in green. Next to that is the icon to book a telephone appointment with the admissions team, and the speaker profile icon to view your speaker's full bios. Now, let's go over the agenda. So we'll have the chance to meet our panelists who will be speaking about the GW School of Medicine and Health Sciences. We'll also talk about the GW School of Business, since this program is offering the unique curriculum from both schools. And we'll look in detail the curriculum in terms of the core, the elective courses, and the certificate options. And our team will be talking about the admissions requirements. And finally, we'll have a chance to go over your questions during our Q&A segment. Now, I'd like to introduce you to our panelists. With us today is Dr. N. Andrew Cohen. He is the Director of MBA Programs and Professional Lecturer of Management in the School of Business at George Washington University. He teaches organizational behavior, human resource management, organizational change, leadership, and social networks to undergraduates, MBA students, and the executive audiences. Professor Cohen was honored with the Outstanding Undergraduate Faculty Award at GWSB for the 2013 and 14 academic year. Dr. Cohen holds a Ph.D. in Management from the Wharton School at the University of Pennsylvania and a BA in Applied Mathematics, Economics, and Philosophy from Brown University. His research centers on social networks, teams, leadership in the workplace. His work has been published in Organizational Science and the Journal of Educational Change. He is a member of the Academy of Management, the Society of Industrial and Organizational Psychology, and the American Psychological Association. Dr. Cohen is a rabid football fan, an avid downhill skier and sometimes ski instructor, and a building cyclist and triathlete. Next, our next panelist is Dr. Leslie Davidson. She is chair of the Department of Clinical Research and Leadership within GW School of Medicine and Health Sciences. She served as an adjunct professor in the Doctorate of Occupational Therapy program at GW School of Medicine and Health Sciences. She also served as an All-Rise Faculty Fellow in the Rehabilitation and Reintegration Division of the Army Office of the Surgeon General, and was subject matter expert on the U.S. Army Medical Research and Material for the Command, Telemedicine, and Advanced Technology Research Center. Dr. Davidson is a widely published author, and her research has appeared in many prestigious academic journals, including the American Journal of Occupational Therapy, Physical Therapy, Military Medicine, and OT Practice. During her career, she has also been honored with many accolades and awards. We're also happy to welcome Dr. John Young. Dr. John Young is an assistant professor of clinical research and leadership and co-director of the Healthcare Quality Program in the Department of Clinical Research and Leadership at the George Washington University School of Medicine and Health Sciences. Prior to joining the SMHS faculty, Dr. Young was a senior principal and engagement manager in the Health Innovation Mission area in Nobles, Inc., a science, technology, and strategy consulting firm. Dr. Young is a former senior advisor in the Centers for Medicare and Medicaid Services. And he earned his doctorate in information management from Syracuse University School of Information Studies, a master's degree from Georgetown University, McDonald School of Business, and a bachelor's degree in health systems management from the University of Maryland University College. Dr. Young serves as a public member of the Board of Directors of the Federation for State Boards of Physical Therapy. And finally, our next panelist is Amy. She is the Director of Academic Operations in Health Sciences and an adjunct instructor in the Department of Clinical Research and Leadership. Her research interests include leadership, human resource development, organization development, and online and adult learning. She has over 9 years of experience at George Washington University in health sciences. She has a bachelor's degree in history and a master's degree in distance education from the University of Maryland. She has 2 grown children, a daughter and a son, and enjoys travel, walking, and reading. Welcome, everyone. And now I'd like to have Dr. Cohen enter our stage to address our audience.
Okay, thanks so much, Kara, for those introductions and for getting us started today. For those of you on the East Coast, good afternoon. For those of you who may be a little farther west, if you're on the Pacific, in the Pacific time zone, good morning. Thank you all for joining us today. I greatly appreciate it. I have just a couple of opening remarks before I'm going to turn it over to Dr. Young, who will talk about the School of Medicine. But I wanted to frame a little bit what this program is and maybe importantly how it fits into George Washington University. We have here at the Business School at George Washington University about 800 MBA students, and about a quarter of them, a little bit less than a quarter of them, are in this program. And I frame it for you that way because this is an important part of what we do here at GW. And in particular, although GW is a very prominent university in the Washington, D.C. area, we are also kind of quietly and stealthily a pretty significant online educational player. And so a large portion of our students in our MBA program are actually in one of our 2 online formats. The Healthcare MBA is actually one of them. So as you listen today, I want to encourage you to listen through that lens of we've got a significant investment here, and hopefully you'll see the power of that as we go forward. So as we dive in, our mission today is to tell you about the online Healthcare MBA here at GW and to hopefully convince you that it is something that you want to take on. As you listen to us, I want you to listen for 3 things. One is, working on the lower left-hand side part of this slide, is it practical? Will you, as you go through this program, learn skills and particular areas of expertise that you know that you can apply quickly and in the workplace? That's something that we pride ourselves on here at George Washington University on both sides of the house. We'll talk about that. And I encourage you to kind of look for that as we go forward. Secondly, it's comprehensive. So one of the things that I will touch on a little bit later, but I want to highlight here is that when you get an MBA from George Washington University, whether you're on campus or online, it is a full-on MBA. It covers all of the bits that make up what we believe to be a comprehensive business education, a general management education. And as we'll talk about later, what you participate in online is really the same as what you would participate in on campus. So that when you think about an online MBA offering, you should be asking, how does this compare to what I could do on campus? And in our case, they're actually quite the same. Finally, perhaps most importantly, one of the things that we see in our Healthcare MBA is its relevancy. One of the things that's very unique about this degree, and it's why I'm going to hand off the presentation here in just a moment to Dr. Young, is that ours is a partnership between 2 very high-quality schools within our university, the School of Business and the School of Medicine and Health Sciences. So that when you take courses in this MBA that are on the healthcare side of the curriculum, you're taking them from one of the premier medical schools in the country. As you look at other healthcare MBAs, I encourage you to kick the tires on that because I don't think you'll find that in that many places. And what that means is that when you finish up, you should look back and say, wow, that was on point and leading edge, and it was relevant to what I'm up to here. So those 3 things I encourage you to listen for as we go through: practicality, comprehensiveness, and relevancy. And I'm going to start by turning the relevancy point over to Dr. Young, who can talk to you a little bit about the George Washington School of Medicine and Health Sciences.
Great. Thank you so much, Dr. Cohen. First of all, let me just welcome everyone on behalf of the School of Medicine and Health Sciences. We're certainly just thrilled to be here and give you some information about the School of Medicine and Health Sciences as it relates to the MBA program for the business school. Just a couple of tidbits about the school itself. George Washington University School of Medicine and Health Sciences is the 11th oldest medical school in the country and the first in the nation's capital. And I think there's a fun tidbit about first in the nation's capital, George Washington University is the only school in the district in Washington, D.C. that is allowed to hold its commencement on the mall with the George Washington Memorial as its backdrop. It's just a phenomenal sight during commencement as well. So also we're globally recognized as an academic medical center with highly ranked programs in health and biomedical sciences. And essentially, when you look at the rankings of medical schools, and I want to note we're talking medical schools and then as well as health sciences, but from the medical school side, we're highly ranked as well in research and in primary care. And I think that's important in terms of an education from a ranked medical school in collaboration with this business school. One of the things that I'm really proud of is that the School of Medicine, in collaboration with this Faculty Medical Associates or MAC Medical Foundation, is actually launching an accountable care organization. And if any of you are familiar with health reform, you know that ACOs are at the center of care delivery and is an innovative healthcare model that's emerging. And we're pleased that Medical Faculty Associates have actually launched an accountable care organization. We're also at the forefront of medical education. I'm actually a participant myself in what we call Master Teacher. It's a leadership development program where faculty are selected to participate in an innovative academic program for actually our faculty. And I'm one of the few online teachers that actually participates in this program, so it's certainly an honor. But we've shown a commitment to medical education and health sciences education by making sure that our faculty have access to such training programs. We're definitely dedicated to improving the health of our local, national, and global communities by the numerous programs that we have. And we also have more than 3,000 faculty members that consist of core educators, clinicians, and researchers with real-world experiences. And again, I just sort of harken back to my own experiences of having been at the forefront of the Affordable Care Act, not just implementing the Affordable Care Act, but actually working with federal government and local and national experts in drafting the provisions of the Affordable Care Act. And I can assure you, I only scratched the tip of the iceberg in terms of the faculty that we have with relevant real-world experiences, such as the colleagues that I have here on this online with me now. And then also our clinical partners are GW Hospital, GW Medical Faculty Associates that I mentioned there just a second ago, and then Children's National Health System. Most of what you're seeing here on this slide is related to the medicine side of the school, but also keep in mind that in health sciences we have ranked programs in physician assistant programs and in physical therapy, as well as in medical education as well and regulatory affairs. So with the emergence of interdisciplinary healthcare throughout the country, it's important that as you begin your academic training in business, that you have access as well, especially with the focus in healthcare, that you have access to an array of experts who are widely known and renowned in their discipline. So with that, I'm going to pause right there, and I'm going to turn it back over to Dr. Cohen.
Okay, thank you, Dr. Young. I want to jump forward here. One thing as we kind of make the turn here, we're kind of making the pitch on the slide that you're looking at here for what, why do this at all? And I think really the reason to do this is for the possibility of doing a healthcare MBA is for the possibility of thinking about what else goes on in your career beyond sort of the pure healthcare side of things. Now, at some level, if you're on our webinar with us, that's obvious to you. On the other hand, I kind of want to make the point that part of what we see ourselves as doing here in the Healthcare MBA is helping you make that transition, or helping you broaden from what has for many of our students been kind of the core healthcare training into how do you parlay that, how do you extend that into an administrative, managerial, or business side career, if you will, or role. So that's very much the kind of the perspective that we bring to our healthcare MBA, and that's really why we put these two schools together, if you will, in running this program. Okay. So,
and if I can jump in there with you for a quick second, and I apologize for jumping in there with you, but just in terms of the statistics that you see here from the U.S. Bureau of Labor Statistics, I think it's just it has to be said that in terms of with the emergence of health reform, and again the interdisciplinary nature and interdisciplinary nature of healthcare as you see here that pretty much many of the healthcare programs or actually jobs in healthcare are growing at that much faster than average clip. Here you see on the slide that medical and health services managers, also called healthcare executives and healthcare administrators, are growing at a 12% rate, and which again, the much faster than average designation is very important here. And then management analysts, often called management consultants. And I think that's one of the more forgotten jobs, I think, in healthcare. But again, if you look at the statistics, it's actually growing very fast, especially here in the D.C. area and actually around the country as more resources are being dedicated to consultancies at the federal, local, and sort of state level, even internationally for that matter, helping to create and develop health systems and make them of high value, if you will, for both patients and for providers as well. Also with social and community service managers, this is a very fast-growing profession, if you will, at 18%, again, much faster than the national average. Here you're going to see social workers, you're going to see mental health workers. You'll also see many of the jobs that were created through the Affordable Care Act, such as navigators and such. They're growing quite fast. And there's a real emphasis, if you will, on community health services and community clinics that are emerging as high-quality centers for access for vulnerable populations and many others as well. And then, of course, physicians and surgeons growing at a much faster clip here at 13% as well. So I think what this slide really articulates is that just on average, you see the jobs report on a month-to-month or on a month-to-month basis. Healthcare is typically there at the forefront. So again, this is very important. And I think it also speaks to as well with business being at the foundation of medicine, sort of the business of medicine is really important as well. So again, that's the sort of the essence of the slide and the evidence behind the U.S. Bureau of Labor Statistics data. Sorry, Andy, just need to jump in there with that.
No apologies necessary. Thank you, John.
Okay.
And I think it's a wonderful segue to, we've spoken a bit about the School of Medicine and Health Sciences. Now I would like to speak a little bit about the School of Business from the slide that's in front of you here. The George Washington University School of Business, as you contemplate taking on an MBA program here, we are a nationally ranked business school. We have about 3,500 students within the School of Business that's split fairly evenly between undergrads and graduates. And then within our graduate program, which makes up about 1,800 of those students, it's about 800 in our MBA programs of various sizes and about 1,000 in some of our specialized master's programs. So that when you contemplate joining the Healthcare MBA program, you are joining a sizable, well-known, well-regarded business school that has partnered with a very well-known, very prominent School of Medicine and Health Sciences to deliver this program. As I said earlier, the other thing to know about us is that while we have a large physical presence in Washington, D.C., we are quietly actually a sizable online player, so that if you worry about what does it mean to be online, I encourage you not to, because we've got this down. And in fact, I'll talk about that on the next slide. But again, what we're doing is bringing together these two players to deliver you the business foundations in the healthcare that you can then parlay into kind of the healthcare world. So with that in mind, let's start to talk about the MBA. As I said on the second bullet point here, we view this as the best of both worlds. So what we're offering you at George Washington University is a marriage of the best of the GW School of Business and the best of the GW School of Medicine and Health Sciences. We've been at this quite some time. So our online and healthcare MBA is one of the older ones in the country. It's been operating now for 15 years. It's gone through a couple of iterations, and this model that we're displaying for you now is a few years old. We like it very much. We think our students like it very much, but we are constantly evolving and innovating within this program to bring you, the student, the best we can bring. One of the things that I'm going to encourage you to listen for as I get down into the next set of slides is that our MBA is fairly customizable. So I'll talk in just a moment about our core curriculum, which is not that customizable, but then the rest of it, your electives are really quite customizable. You can pick and choose what you take, and importantly, you have the opportunity to bundle your electives into a number of graduate certificate options, and Dr. Young will speak about those when we get there as well. The other thing I want you to know is that when you come and take this program, you are taking this program from an elite faculty. On both sides of the house here, in the business school and in the School of Medicine and Health Sciences, we do something that is also not that common in the market, which is the same faculty that teach on campus teach online. So that when you take our online courses, you know you're getting the best of GW. And I think that's an important thing for you to be thinking about. That's something that's not easy to pull off in this world, and I think we do a pretty nice job of it, but it's something for you to consider as we get in there. I'll also add, for those of you who are actually located physically not that far from GW, because I don't have it on the slide here, one of the things we do offer on the business school side, which is about 3/4 of the courses you'll take, is you can take any of those courses on campus if you wish. That's something that, again, is somewhat unique within the business school environment, so that if you're nominally listed as an online student, you may come and take courses on campus. And I make the same pitch to my on-campus students. If you're nominally labeled as an on-campus student, you can take any course online. So actually, I know we had a cohort of students that started with us in the spring, and I had dinner with them on the first night of class here in the building at GW, and was actually sitting having dinner with a couple of our Healthcare MBA students who were starting in the spring because they had chosen to split their initial semester into one course online and one course on campus because they were close enough to do that. We're perfectly happy with that, and we'll work to facilitate that for you. The final thing I encourage you to think about is that our Healthcare MBA, by design, attracts a fairly diverse set of students from across the healthcare industry. I believe most of you will find that attractive. I can understand that perhaps some of you won't, but we have a wide range, both in terms of experience and in terms of area of specialty. I think that makes for a very rich, invigorating set of discussions within the classroom environment. So now I want to pay off the claim that it's comprehensive, and by doing that, I want to talk about the curriculum. So I would like you to think about the curriculum in our online MBA, online healthcare MBA, as being in 3 parts. The first part is our core curriculum, which I'll talk about in a moment. The second part is your freedom to take electives pretty much anywhere in the university, as long as, well, yeah, anywhere in the university, period. And then the fourth is, one thing that is unique about the Healthcare MBA is that you're actually required, and I don't know why we say required because most people want to, you're required to take 12 credits of your electives from the School of Medicine and Health Sciences. Most of our Healthcare MBAs ask if they can take the other 12 credits there, and I think with some exceptions they can, but that is something that we're open to. So think of it as 3 portions: the core at the School of Business, the electives anywhere in the university, and then the electives at the School of Medicine and Health Sciences. And then the other things to consider, which we'll come back and talk about, are the ability to package your electives into what we call graduate certificates, either at the School of Business, but really more importantly at the School of Medicine and Health Sciences, so that what you would get when you complete your degree is actually 2 credentials. Our certificates are credentials. They're separate credentials that show up on your transcript. So you'll have an MBA and you'll have a graduate certificate in whatever discipline you've chosen. That's something that we're quite proud of here at GW, and again, is not always as frequently offered, if you will, in the marketplace. Finally, despite being online students, we do offer you the opportunity to study abroad, and our Office of Global and Experiential Education does provide opportunities for you. Many of them operate between the fall and spring semesters, kind of during the early part of January, which means they're available to everybody. And so at the right time, we can talk to you about that. Okay. So to dive down, I mentioned that kind of about half of the curriculum is the core business core courses, if you will. You can see that it accounts for 31.5 credits out of the 55.5 total credit hours. Two things that I would like to draw your attention to here. First is the very first course on the page, listed as Foundational Management Topics in Healthcare. This is a course that we have developed specifically for this MBA program. It is our way of indoctrinating you into the business side of healthcare early so that we then, when you then take the more business-focused courses, you're able to make the connection between where you've been and where you're going. This course is actually led by Dr. Ayman Tarabishi, who is the faculty director for our Healthcare MBA. He gets rave reviews for it, and again, is something that I think is unique for us in this program. After that, you'll take the other 28.5 credits across the areas you see here. If you look carefully, what you get is a very broad cross-section of kind of topics and functional areas such as business ethics and public policy, or organizations and human capital. Organizations and human capital is about the human resource and cultural parts of organizations. On the other hand, you'll also get a deep dive in critical functional areas like financial accounting, finance, managerial accounting, and marketing. And we'll ask you to take courses that kind of scan the horizon, if you will. So microeconomics for the global economy or strategic management are really about looking out and understanding the environment that affects the organization or business that you're in. So this is a pretty rich, pretty broad, pretty robust look at the business landscape. And again, this is the same core that any MBA student at George Washington University will take. So again, same professors, same content, same syllabus, etc. We then note to you that after the core, you can start to take electives. The point that I want to make here is that you'll take probably 4 electives, that each course tends to be 3 credits. You can take them from any of the schools that offer 6,000 level courses. Most of my students, to be fair, do take them in the School of Business or the School of Medicine and Health Sciences, but that's simply because that's what they find interesting. I do want to note that one of the areas of strength at George Washington University is the Elliott School of International Affairs. It's one of the premier schools of international studies in the country, so that if you find a course that is of interest to you there, I encourage you to take that. Finally, on my part, before I turn it back over to Dr. Young, I do want to highlight this point I made earlier about study abroad. We do make a fair amount of opportunities available to you, even as a part-time online student, to study abroad. You see the kind of 10-day, 2-week short-term study abroads. Those are in particular between between the fall semester and the spring semester, which is basically the first 2 weeks of January. We do something similar at the very end of the spring semester, which is really the second half of May. So to the extent that you can structure your time and want to go abroad, we have about 17 programs that we run of that level in conjunction with premier universities throughout the world, and they too get rave reviews. Part of what distinguishes the GW MBA from other MBAs is our emphasis on the international side of business. And so that shows up in our core curriculum with a core course on international business. It shows up in our partnerships with the Elliott School, and it shows up here in our study abroad opportunities. So with that, I would like to turn it back to Dr. Young, who can then talk to you about the third and possibly the most interesting and important part of our curriculum, which is the piece that occurs at the School of Medicine and Health Sciences.
Great. Thank you so much, Dr. Cohen. So before I delve into the specialization areas in the certificate programs from the School of Medicine and Health Sciences, I just want to sort of piggyback the notion about online education. And one of the things that I'm really proud of that we do here at the university, and specifically in the School of Medicine as well too, is we make sure that we put students first. I have a motto of which I actually have adopted quite some time ago when I began, and that is a student first motto. And that means that as I get into the online courses day to day, I make sure that I respond and serve the needs of the students first and foremost in my daily activities, which I think is really important too, because it's really important to establish an online connection with students. And another thing, too, I think is important is, as Dr. Cohen mentioned, if you're in the area or near the area here in Washington, D.C., I always encourage my students to come by and see me. Come by. They're a student here at the university. They're certainly welcome to visit me for office hours in my office if they don't want to do it online. So I think that's one of the more wonderful things about being here in the district as well, and inviting students to connect, which I think is really important. So as you see here on the slide, there's an opportunity for 12 credits with a healthcare-focused elective. I'm going to walk through each of these in detail, but here's just a quick overview of the electives that you can choose from the School of Medicine and Health Sciences. You see 4 of the topical areas here. The first is in clinical research and administration, and critical analysis and clinical research, and medicine development are a couple of courses that are offered there. Then you have healthcare quality, of which I'm actually the co-director of the program. You have health sciences and regulatory affairs. So let's delve into those topics a little bit further here. So let's start off with the graduate certificate in healthcare quality. The certificate was developed to meet an emerging demand for quality and patient safety specialists. And this is really important, especially, again, with health reform. Being located right here in the district, we have access to the Department of Health and Human Services, where many of my former colleagues worked in Centers for Medicare and Medicaid Services, and ARC, and HHS, and many of the other operating divisions. And quality is a key component of healthcare reform. So in our healthcare quality program, you're going to get a rich education in not just clinical quality measurement, but also in performance improvement as well. And these are desirable skills across the healthcare system that creates value, again, for patients and providers, and most importantly, optimum healthcare outcomes for our patients. The graduate certificate in regulatory affairs, again, developed through a collaboration with the regulatory affair professionals in the healthcare industry and government agencies. Again, one of the strengths of the institution is being right here in the district, where you have not just, again, CMS and certainly HHS, but FDA, which has campuses right here in the district and as well as in Silver Spring. And really an important and growing field in terms of regulatory affairs and sort of biomedical sciences as well. Then the third one is in a graduate certificate in clinical research administration that prepares health sciences professionals to participate in science and business, in the science and business of developing new therapeutics and improving patient care, and then also focuses in on regulatory requirements, ethical issues, processes for product development. I've had a number of students that have come through this certificate program in my course, building a culture of quality and also issues and trends in health systems, and just the richness, I think, that the clinical research administrators and clinical research scientists bring to the course, I think is quite phenomenal. They're in government, they're in private practice. So again, lots of opportunities, lots of insight that you're going to get from faculty here in our program. Really, again, I can't emphasize enough essentially where we're located here in the nation's capital, especially when it comes down to clinical research administration and regulatory affairs as well. We also have a graduate certificate in clinical research practice. This one prepares our graduates with the requisite knowledge and skills to conduct clinical research. And again, this is really important. And again, in this area in Virginia, Maryland, and D.C., we call it the DMV, you have a number of firms here, consulting firms, that actually we rely on to help us with building our programs as well around clinical research and that science as well. Then also, just sort of back on the regulatory affairs side of this, we have a summer regulatory affairs symposium that is hosted here at the university as well. So again, the richness around clinical research practice and regulatory affairs and clinical research administration, I think is really key. And then also we have a graduate certificate in clinical and translational research. This is important because what's happening here is that you have the National Institutes of Health that actually does lots of research in an array of healthcare topics, but the issue here is how is it translated actually into practice? How is it translated into our Medicaid and Medicare and commercial programs on the ground? So again, this certificate is designed for those who are really interested in translational science and implementation science. And of course, we have a new Ph.D. program in clinical and translational research as well. So again, we have a strong presence in this space here at GW. Then also we have a graduate certificate program in clinical and translational research. This particular certificate, and actually I take that back, that looks like a little bit of an error, but I'm going to talk about in health sciences as well too. There is a certificate that would allow some study around epidemiology and public health as well. Some of these are transitioning and developing, if you will. But again, the key here is that you have a number of topics that you can actually refine your skill in with the foundation in business. I think is really important. Multidisciplinary, interdisciplinary is really the key here. And I want you to take that away with you as you begin to, again, look at the certificates that we have and think about how you want to refine your training in business. You see integrative medicine down there. That's not a certificate that we actually have that's been approved, but again, we have a strong program in integrative medicine that is, I think, going to be really on the cutting edge of healthcare delivery here for the future of medicine. So really excited about that. So that's not a certificate program that we offer at the moment.
John,
I'm going to turn it back over. Oh, absolutely, yes.
Yeah. So I just want to clarify for a couple of the people who are on the call. This is Leslie Davidson. When you go for the Healthcare MBA, you do not have to necessarily get a certificate. You can get the Healthcare MBA and go through a number of our programs and the plethora of courses that we have and pick and choose those courses that you think will help you with your professional goals. So if you choose to get to take a course in the regulatory affairs as well as healthcare quality and then maybe another one in translational health science, you can do that. If you choose to take a more targeted approach, we would recommend that you go for the certificate. But we identified the certificates that are up here that we offer now with the Healthcare MBA, as well as some certificates that we have that we're going to put through curriculum committee, like integrative medicine, that you can move forward with. But just know that you can either go cafeteria style with the health science and medicine courses, or you can target to specific areas. That's it.
Great. Thank you, Dr. Davidson. Appreciate that clarification. Dr. Cohen, I'm going to turn it back over to you for the application requirements.
Excellent. Thank you, John. I appreciate that. So on the slide in front of you, folks, I'm actually going to start on this is all about how do you apply and how do you get in. I'm going to ask you to start on the right-hand side. I want to focus on a couple of dates. First thing I want to say, which is actually not on the slide, is that we have the ability for Healthcare MBA students to start in any of our 3 semesters, in the summer, which is what I'll talk about in a moment, in the fall, which would really be end of August, and in the spring, which is really mid-January. So as you start to think about this, as I'll say right now, we're taking applications for the summer, but if the summer feels too fast, by all means, think about the fall. We do admissions year-round, and would be happy to have you start in the fall if you don't want to start in the summer. Having said that, we are still accepting applications for the summer. The summer term starts on May 21st, and the priority review deadline is April 10th. The priority review simply means we'll get it done fast and give you a decision as to whether you're in the program or not quite soon after April 10th so that you can make the plans that you need to make. We have room in the class at this point and would be delighted to have you join our program starting on May 21st. To make that happen, if I take you to the left-hand side of the slide, what do you need to file? Well, it's pretty straightforward. There is an application form and a fee, but if you notice there's an asterisk there that says we'll waive that fee for those of you who participated today, so keep that in mind. I think the fee is $85, but it probably doesn't matter. Secondly, we do nominally require a standardized test score, a GMAT or a GRE, but if you notice it says where applicable, we do offer the opportunity for you to request a waiver of that, of supplying standardized tests. There are two flavors of that. If you are a board-certified physician, then we will waive it. All we need is proof of your certification, and we'll waive the requirement of the GMAT or the GRE. In addition, even if you're not a board-certified physician, we will take a look at your employment history. We tend to offer waivers for people who have 5 or more years of employment history. That's not a blanket guarantee, but that is something that we would look at. In addition to those scores, we'd ask you to upload a resume or CV, one professional letter of recommendation, someone who you've worked with and worked for who can speak to your capabilities, and then one essay, which we call a statement of purpose. Why do you want to do this? And I think that's the key thing that I would point you towards as we look at it from an admissions standpoint. How is this going to augment you in your career? How is this going to take you places? How does this fit in with where you've been and where you think you're going? We do, of course, require any and all university-level transcripts, from all universities that you've taken courses at. As I said, for board-certified physicians, we want your certifications, but that's really to waive you out of the GMAT. And then if you are not a native English speaker, we would need your TOEFL scores as well. So that's a fairly streamlined and stripped-down set of application requirements. We have a talented group of enrollment and admissions coaches to help you through that. They are on the next page, and they're happy to stand by and take your calls or your emails to kind of get you started. I believe Alana Person is actually on our call today, so that during the Q&A she can answer some of your questions as well. But these folks are instrumental in helping you sort through how to whether you should choose this program, which of course they're a little biased, and how to get through the application process. So I encourage you to lean on them as you go through. And with that, I believe, well, actually, before I turn it back over to Kira, I do want to say 2 other things that Dr. Young's comments triggered for me. He encouraged you, if you're nearby, to come in and see us, and I want to echo that. But in addition, I think one of the challenges of online education is actually staying connected between student and faculty, student and university. 2 things that I'd like you to consider about our program. One is in the business school courses, the vast majority of the online courses you take will include live audio and video sessions with faculty and students. And so there is a real opportunity to get connected to your classmates by virtue of the format of our courses. It's not on a slide anywhere. And then secondly, we are in the early stages, but not right at the beginning. We're in the early stages of running an on-the-ground local outreach and connection program. And so what that looks like is that when we have faculty who are in local markets for conferences or other business, they will pull together groups of our online students for lunch or dinner or networking events. We have 3 of those planned over the next 90 days in Atlanta, Philadelphia, and Minneapolis. We'll possibly have one in Miami. And so that's something that you'll see more of over time. So as you think about, am I part of this community? Increasingly, the answer is yes, and I encourage you to think about it that way as well. So now, with that, I'm going to turn it back over to Kira, I believe, who's going to moderate our question and answer session.
Perfect. Thank you so much, Dr. Cohen. Yes, so our first question here is for you, Dr. Cohen. So could you speak a little bit about the demographics of students in our program and just, the virtue of the marriage between the school of business as well as the school of medicine and health sciences and how that benefits the student demographics following the program right now? And, to our other panelists, feel free to chime in as well.
Yeah, so let me talk a little bit about the demographics, and then, yes, as you said, I'd love for everybody to join in on the how does it benefit. So as I said earlier, we actually have a pretty wide range of students within the Healthcare MBA. I believe that our median age in the Healthcare MBA is about 32 or 33, but it's quite wide from people who are just a couple of years out of college and in the early parts of their healthcare career, through to physicians who are chairs of fairly sizable departments in fairly sizable hospitals. I think that's actually one of the beauties of our program. I think there are those who will think it's not a beauty, so I'll just be honest about that. But I think that's one of the things that I see as one of the beauties of the program. I will say about 40% of our students are board-certified physicians. We have a roughly equal split of men and women, and that's true in most of our MBA programs. That, too, is unusual. Most MBA programs are skewed towards men, but ours are almost exactly 50-50, and that is both an artifact of history and by design. We have a strong relationship with the Forte Foundation, whose mission is to increase the prominence of women in the business school and business community. In our online program, ironically, the vast majority of our students are U.S. citizens and are located in the United States. In the Healthcare MBA, the students are actually distributed geographically around the country quite broadly, which I think is also a real positive. I think that two things are true. One is I think the demographics really benefit the student because there's this tremendous amount of diversity in the classroom and therefore diverse perspectives in the classroom, the virtual classroom, if you will. And then I think that the relationship or the joint offering, maybe is what I would say, between the School of Medicine and Health Sciences and the School of Business is really quite powerful. You know, each is bringing its strengths, but we're doing it in a way that we've thought about as opposed to just plugging it in. So you're going to get deep business expertise within the business school, but then the School of Medicine and Health Science has carefully selected the set of electives and graduate certificates that really make sense for someone who's making the transition, the way I think about it, from being a more narrowly defined healthcare practitioner to being an administrator, regulator, or whatever it turns out that you want to do. And so I think it's a very nice glide path. I also think the way the curriculum is laid out with the starting point of our foundational course in management and healthcare, then diving into the core business courses, but then providing the opportunity to move back to how do I implement those and think about those within a healthcare environment makes good sense as well. Are there others who want to chime in on that?
Dr. Cohen, if I can just piggyback on what you said there, just a couple of things about what I actually see in our courses in health sciences, and I would hope that my colleagues, Dr. Davidson and certainly Amy, chime in as well. But one of the things that I'm always intrigued about and impressed with our students is that they're multi-generational, they're multicultural, and of course they're certainly multi-discipline. Meaning that our students, they come from many international countries, from Africa and Canada, the Caribbean, and so forth, and then also many professions. Again, one of the wonderful things about the variety of programs that we have in terms of our certificates is that we get professionals who are nurses, of course, those who are physicians. We get lots of federal employees. We get lots of clinical lab scientists. We get lots of folk who are interested and actually serving in regulatory affairs capacities. And I think the interesting thing that I'm seeing emerging as well, too, is that we're getting students who are actually very interested in community-based health systems as well because of the robustness and richness that they bring to this sort of ecosystem of healthcare. And I think that's really important to note that when you get into one of our online classes, you just take that sort of mix of students, and I think it really does create a really phenomenal and rich learning community online. I'm going to pause right there, see if anybody else wants to jump in.
Well, thank you, Dr. Cohen and Dr. Young, unless Dr. Davidson has anything to add as well as Amy King. So we are actually coming very close to the time allotted. So we have time for one more question. And just so you know, I know we've been receiving quite a number of questions coming in through the Q&A. And if we're not able to get through them during the session, our admissions team will definitely get in touch with you today to make sure all of your questions are answered. So thank you so much for your patience. So the last question I have here is for someone in our audience who currently has a Master of Arts in Health Administration from a school in New York, would you recommend pursuing an MBA-HC as well, or would you say that an MHA is sufficient? And this could be answered by Dr. Cohen, Dr. Davidson, or Dr. Young. Thank you.
Wow. Does anybody? I'm happy to comment on that, but Leslie and John, I don't know if you want to comment on that.
Yeah. I can comment on that just because I'm familiar with the certifications, for the MHA. I think it's going to really depend in terms of what your goals are. With regard to the typically the Masters of Health Administration, there'll be some repeating type or redundancy in terms of the programming, but the Healthcare MBA will be much more in depth, and with the courses given in the School of Medicine, I think you're going to get much more kind of breadth and depth, specifically in some of the specialty areas that you're taking courses here. Healthcare administration will give you a strong background in terms of supervision, management, whereas the MBA will probably give you more in depth for kind of senior leadership positions, lots in terms of consulting. It's hard to say without knowing exactly what program you went through, but I would just say it's more kind of depth with the MBA and what your career goals are. John, you want to add to that?
No, I think you really hit it on the nail there. Just real briefly, one thing that I will add to that is typically you want to think about the setting that you might want to sort of work in as well. I think I see a lot of MHAs in hospital settings. But again, it's not specific to that. I want to make that very clear. And then a lot of MBAs who are interested in sort of the business of medicine and healthcare in practice settings and associations, just all over the place. So again, I think the line is fairly drawn close there. But I think the advantage that we have with the MBA, which is certainly a widely recognized credential, you also have the opportunity for specialization in the language of current healthcare, and I think in like value and patient-centeredness and ICD-10 and precision medicine, leading those types of entities. So it's a matter of choice, but I think you have to really think about also what type of setting you're interested in working in.
Thank you so much. So that sort of covers our Q&A segment. I know we do have a lot more questions coming on from our audience, and as I promised earlier, we will be in touch with you. One of the members of our admissions team will be in touch. So there's Rajiv Sharma. You see his contact there on the screen, as well as Ilana Herson, who is available here for Q&A, and Deborah Sachs. And alternately, if you'd like to get in touch with them to book a telephone appointment, there is the link chain icon that you can click on. It'll take you directly to the online scheduler where you'll be able to assign a time to speak with them. And once again, our upcoming start date is May 21st, and the deadline is approaching. There's still time, and our team will be happy to work with you to help build the strongest application portfolio possible with you. And thank you so much to our panelists for providing insights about GW's online healthcare MBA. It's a wonderful opportunity to hear your perspective from the School of Business as well as the School of Medicine and Health Sciences, where our curriculum is sourced to our attendees. I hope you have found our webinar informative and beneficial as part of your online healthcare MBA discovery process. Thank you for spending time with us, and we look forward to welcoming you to our upcoming courses, with summer 2008 term coming up as well as the fall this year, and we look forward to working with you. Thank you so much, everyone, and enjoy the rest of